はいはいはいはいはい。日本日本はいはいはいはいはい。
非常高兴来到台湾。Now let us begin our presentation. Look at these pictures. Do you know this disease? Maybe of course you know. The answer is Hansen's disease. Hansen's disease is known as the typical stigmatized disease in Japan. Now, let's think together. Why this discrimination occurred? Here's the content. And first, we're going to talk about the history and present situation of the disease. Mr. Sanai, please.
Thank you, Maki. 大家好，非常荣幸让今天来台湾见面，谢谢。Let me talk about the knowledge about Hansen's disease. This is Michael. What causes Hansen's disease? By air. It's not very infectious. It prefers to invade human skin and peripheral nervous system. So, the clinical symptoms will be face and skin lesion, nerve paralysis, which can result in difficulty walking or grasping, and can lead to loss of fingers or toes. Facial nerve paralysis, which can eventually cause blindness. So it's a treatment in 1940s, promising effective medicine became available. And now, MDT, multi-drug therapy, is most effective. Due to the effective therapy, the number of the new cases each year in Japan is close to none. And about the dark history of discrimination in Japan. In 1907, the first regulation toward Hansen's disease was made. Then, since Japan won the war against Russia, it became one of the great powers in the world, and it thought this disease was a national disgrace. So, in 1931, they established the leprosy prevention law. Under this law, 15 sanatoriums were built, and forced isolation, sterilization, or abortion carried out. Moreover, in 1936, a campaign against Hansen's disease had occurred in every prefecture in Japan. By this campaign, many patients were forced to sanatoriums, and people became more fearful. So in 1940s, although the problem became available, the Japanese government didn't change law. Due to the effort of the patients, finally, in 1996, the law was abolished. And in 2001, they won the suit against the government. It looked like a happy end, but even now, discrimination still remains. In 2003, one hotel refused its patient to take a public hot spring. That was a very terrible story. So, let us think about who has the responsibility in Japan. Although United Nations and some Japanese doctors have criticized the Japanese government because this disease is not very infectious and there is no need to isolate the patient. But Japanese government didn't listen and didn't change the law. And also, Japan Leprosy Association, they didn't give any medical advice to change the law. From the whole story, we thought discrimination is rooted in ignorance, and not only the government, but also the Japanese Leprosy Association. They have overlooked the law for a long time. So we should know more about disease and combat against stigmatized disease.
Thank you, Mr. Sonai. And second, never to repeat the same history, we organized the field work. And Mr. Kimoto, please.
Okay, thanks, Maki. 谢谢你，谢谢啊，你好吗？我是台湾的蜜蜂。This is an overview of our field. Thank you very much. This is an overview of our field study. We went this May 30th to 31st. We went to Komyo and Ise. They are the 2 national sanatoriums in Japan, out of 15 sanatoriums. We went with 29 medical students and nursing students from 14 schools. There are the programs for 2 days. I will explain in detail now. First, we had a lecture from Dr. Hatano. He is the chairperson of Komyo, one of the sanatoriums. He talks about these topics. And he worked in Bangladesh and Myanmar to help Hansen's disease patients. We had a workshop by Knowledge Department of AMSC Japan. They talk about history, epidemiology, and clinical medicine, and law. We visited Memorial Museum inside sanatorium. This person is Mr. Usami. He's an ex-patient, and he kindly showed us around the Memorial Museum. So I have a question for audience. Okay. What's on this picture? Do you have any money? Yeah, that's right, money. Yes. Okay. Sanatorium use special currency, which were only usable within sanatorium. Why? Because even patients escape from sanatorium, they are financially incapable living outside of sanatorium. And we had a sanatorium tour. This is a quarantine house where patients arrived the sanatorium. They have to stay here for the first week. And there was also jail inside the sanatorium. There was a graveyard, so we gave our AMSC member gave silent prayer in front of the graveyard. This is a bridge, but this bridge is very important. Why? The 2 sanatoriums we visited, they are on the same island, but there wasn't any bridge between mainland till 21 years ago. So this bridge symbolized the patients redeeming their human rights again. I have a next question. Interesting one. What's this? Do you have any idea? Bath was filled with disinfectant. The patient have to have a bath like this. We visited ex-patient's house, so we had movie for you to watch. It takes about 30 seconds. So what we learned from our field study, of course, things believe it, and we can share our knowledge with our fellow AMSC members in each school nationwide. And we realized that we are the last generation. We could be the last generation to hear this story from actual patients in person, because most of the patients are already over 70. 谢谢。